Hi, who do I have the pleasure of speaking with?
This is Heaven James.
And what's your recent level of education?
I'm a recent graduate from Cal State San Bernardino with a bachelor's of kinesiology, exercise science.
And how old are you?
I am 21 years old.
All right, we're gonna begin a couple questions asked about where your levels are in nursing and for your questions just to get to know each other. And yeah, are you ready?
Ready.
What inspired you to pursue a career in nursing?
So it started when I was younger. At a very young age, I've always had family members in and out of the hospital, so we were always making trips there. I got to know actually some of the staff that was personally on my aunt's case for her heart, and she taught me a couple neat tricks and tips when she was nursing just to make me feel comfortable when I was in the room with my aunt, so I didn't feel lonely. That's how it stemmed from a younger age in those types of situations.
Nice. What would you do if you felt you were struggling or falling behind in a nursing class?
When it comes to schoolwork and understanding certain material, I'm not afraid to ask for help and get the tutoring that I need. And I'm also not afraid to reach out to classmates to see if they have better studying skills that I could adapt to.
Okay. If you were treating a patient and they or a family member or theirs became verbally hostile, how would you handle it?
So the best thing to learn, what I've learned from my job recently, is when it comes to dismantling situations that become hostile, it's just apologizing with repetition, apologizing and trying to better understand what their perspective is. So basically listening to their side on why they're so hyped up, and then deconstructing this level of intensity by addressing the facts and the matters behind why the situation is occurring.
What about being a nursing student intimidates you the most and why?
The competitive side. So everyone knows a nursing student is very dedicated, very hands-on, 24/7, hardcore studying. GPA has to be over 3.8. Some of them reach to 4.2s. So it's just the competitive side that scares me a little bit, but just a little bit.
If you saw a medical professional acting unethically, what would you do?
I would address the situation, tell him or her what they did wrong, how they could have better confronted the situation, and then basically aware them that I have to tell a higher authority what exactly happened that day in that situation to make sure that fellow coworkers don't do the same thing.
How do you feel about mandatory vaccinations for nurses or other healthcare staff members?
I do think that is fair. We should practice what we preach. So when it comes to vaccinations, we should most definitely be the ones to step out there to be the first trial to see if this actually works before we try anything with our patients or to sell it to our patients.
Can you describe one of the biggest healthcare challenges facing the world today?
One of the biggest healthcare challenges, I would say, is affording healthcare and having people understand specifically what they're getting out of healthcare, what some vaccinations do, what they don't do. There's a misconception with certain vaccinations, but all around just educating the outside world of what specifically our job here is to do.
And what do you plan to work towards solving it?
Yet again, like I stated before, practicing what I preach. So making sure that my patients have a full-on understanding of what's happening, what I am doing with their case, what their case involves specifically, what they can do to better themselves without my help, what medicines they're taking, what medicines do to their body, certain pills, just medications, just all around, give them a crash course of what I'm doing medically and to see if they understand and get a better understanding.
What is the biggest challenge students face in this program? No, what? Sorry, that is not a question for you. How will you make a positive impact on the nursing profession?
I would say my persistence and my personality. So when the going gets tough, I'm really good at giving people advice when they're very frustrated to help them dismantle that stress, considering that nursing is a very stressful topic. I would also say how genuine I am when it comes to specific things about nursing. I know nurses work long shifts, night shifts, and they don't have the energy to keep up with their patients sometimes. But I feel like since I am genuine with everything that I do, it wouldn't matter the time of the day or how many hours I worked. I would still have the same smile as if I came in the next day.
Tell me about a time you made a mistake.
Pertaining to nursing?
No,
Just in general?
in general.
And
how did you handle it?
So working at my recent job, which is Chick-fil-A, I was working in drive-through. I believe I was on window dealing with I believe I was bagging. And the person, my coworker who was on window, was getting yelled at for a situation that happened outside with one of the order takers. So basically the order was wrong and the payment wasn't satisfying the customer. So my coworker looked at me with tears, started crying. So to take the initiative, I switched spots with her so I can get a better understanding and so that she can cool off and go collect her thoughts. And then a manager came behind me and I let her deal with the situation. So when everything got dismantled, I made sure that, while everything was being dismantled, I made sure that drive-through was still running no matter what was happening at window. I made sure my coworker was okay, tried to reassure her that it wasn't her fault. It had nothing to do with her. It was just a situation that was amplified when it shouldn't have.
And how did you handle it? The mistake?
I apologized.
Got it. Can you describe a nursing industry trend that's caught your eye?
A nursing industry trend. I would say I've actually been realizing a lot of nurses who are in school or who have recently graduated and taken certain tests have picked the initiative to make points and notes about those tests and how to pass them with success, and to also implement better study habits for nurses through social media. For example, Instagram, YouTube, or the new trend, TikTok.
And why does it interest you?
Because it gives you a crash course within 10 to 20 seconds instead of reading a book that could take you 25 minutes to understand.
Got it. What nursing skill appeals to you most?
I would say specifically knowing in detail certain medications and the dosages, especially when it's specific to someone who has allergic reactions or their body is just not immune to those certain medications.
And why?
Just because that proves that everyone is different and everyone does take different medications to an extent. Your body will not accept everything. It will most likely reject certain things.
If you're treating a patient who speaks the language you don't, what would you do to ensure good communication?
First, I would ask if they did have family members around who did speak the same language as I do, but if they don't, I would then start to either try to locate someone in the hospital or in the building that's close to me or a wing if they do know that certain language. But if they don't, then that leaves me no choice with using hands, using signs, basically charades at that point until I can find a professional that can help me get further.
Nice. Last couple of questions. How do you describe your a regular day for you?
The goal is to wake up at 7:30 in the morning, almost every day. I do like to take a morning jog. So it takes about till 8:30. That is when I start my actual day, which is a small breakfast, oatmeal, granola, orange juice. And then I proceed with homework, study sessions with my classmates who do Zoom, so we do create Zoom meetings for each other. Just going through my Blackboard on my school page, make sure everything is good, make sure if I can start the week early, I can start the week early, and if I can't, just make sure that I have a heads up on what's to come of that week. And then if I don't have work, I go to bed early.
How would your classmates describe you?
Energetic, bold, funny, and smiley.
Well, thank you, Heaven James. You've completed this interview. We'll be giving you a call back shortly. Thank you very much. My pleasure. It's my pleasure.